Most people don't know that artery inflammation is one of the main reasons people have heart attacks, even when they have normal cholesterol. It builds silently inside the walls of your blood vessels, raises clot risk, and drives long-term damage without warning. In my practice, I see this all the time. And here's the thing that you need to know. Regular lab work is just not going to show this. It will look normal, but inflammation's already active. Cardiovascular inflammation, inflammation of your artery walls. Each day, it brings these people closer to a heart attack. But there is good news. In addition to lifestyle changes, supplementation can help your inflammation in a meaningful way so that you lower your risk of a heart attack. In this video, I'm going to walk you through supplement number 1. Let me tell you a patient story, meaning studies done with real people, not animals, not test tubes. This supplement helped lower C-reactive protein levels, CRP levels, by about 1 point on average. And most of you are not going to know what 1 point means. It's a big deal. Even half a point, a quarter of a point is a big deal. The studies were well designed and showed steady results over 8 to 12 weeks, especially in people who had heart risk or high inflammation. The supplement? It was garlic extract. Most studies used between 600 to 1200 milligrams per day. Garlic's often in a form called aged garlic. It's easier to absorb, it's less harsh on the stomach, and I think it tastes great. It's safe for most people and easy to add to your daily routine. After 3 months, Dave's CRP had dropped, and his inflammation was moving in the right direction, just like the rest of his health markers. Supplement number reliable. The supplement used? Omega-3 fatty acids, specifically the two big ones, EPA and DHA. And yes, I know there's been debate about how much DHA. There's plenty of debate about whether or not you can get safe omega-3 supplements, the vegan forms versus the fish oil forms. But here's the thing. No matter which part of these debates, these detailed debates you get into, you do need to be aware of omega-3s helping most people and being safe in most people. Most studies use between 1 and 3 grams per day, often in concentrated fish oil capsules. Again, not so much for the vegans, but the vegans do have a problem in terms of proper omega-3 supplementation. Now, this is safe for most people, especially when taken with food, and can be a powerful support for lowering inflammation and improving heart health. After about 6 weeks, James's triglycerides had come down, and his CRP was no longer in the high-risk range. It wasn't the only thing helping James, but it clearly made a difference, and it fit his lifestyle, which, as we said, was a little bit demanding in terms of what he wanted to do. He didn't want to change his diet, didn't want to eat fish, but he did want to improve this one thing. Supplement number 3. We looked at the evidence together. In one well-designed study, people with metabolic syndrome took this supplement daily and saw a drop in total cholesterol, LDL, and C-reactive protein, CRP, the inflammation marker we're going to be talking about mostly during this video. The biggest changes happened in people who already had higher cardiovascular risk, like Sharon. Another strong study showed that overweight adults who took 150 milligrams per day for 6 weeks, it showed a drop in oxidized LDL, which supports healthier arteries and also a small improvement in blood pressure. That study didn't show as big a changes in CRP, but the antioxidant effects were clear. Both studies were double-blind, both were placebo-controlled, and results were reliable, not based on guesswork or bias. The supplement she was asking about, and the one she decided to move forward with, was quercetin. You may have been hearing a little bit more about quercetin over the past few years. Most studies use 150 to 500 milligrams per day, and that's often taken with food to help reduce the chance of stomach upset. It's usually well tolerated, especially when part of a broader plan for metabolic health. Sharon took it consistently for 6 weeks. Her oxidized LDL levels dropped, her blood pressure improved, and her overall cholesterol numbers started trending in the right direction. Her biomarkers improved. This was not a dramatic shift, but it gave her confidence, and it supported the work she was already doing. And again, it helped her motivate to continue further in her lifestyle changes. Supplement number 4, studies with cardiovascular risk People who used this supplement for 8 to 12 weeks saw improvements in inflammation markers and better circulation. The results were most consistent in people who were managing early stage risk, just like Renee. The supplement, ginger. Most studies used between 700 to 2,000 milligrams, typically in a capsule or extract form. It's generally safe, it's well tolerated, especially when taken with meals. After a couple of months, Renee's CRP came down noticeably. And while she didn't expect it, she told us that her knees began to feel less stiff. She was no longer dealing with her usual after-meal stomach issues. Her goal was heart health, but it ended up helping her feel better in more ways than one. That was with ginger. Trained in preventive medicine, I ran the program at Johns Hopkins, considered one of, if not the most effective, most important program in preventive medicine in the world. Now, 3/4 of docs don't even know how to diagnose prediabetes or metabolic disease. So these are huge problems. So there are challenges here in trying to find a preventive medicine trained doc. I've trained a team of clinical advisors personally. They work with me every day. Together, we help lower the risk and prevent heart attacks for our patients using a lifestyle-first approach. If you're ready to take that next step, give us a call at 859-721-1414 or click the link in the description below to learn more. And if you're not ready for that kind of commitment, that's okay. Still, please at least download my free 7-step heart attack prevention protocol. You need to know some of this information because your doctor likely doesn't, and you need to be able to have better conversations with him or with her. The supplement had a drop in CRP by about 1.33 milligrams per liter. That is huge. The results were most notable in people who had elevated inflammation to begin with. The benefit wasn't tied to a certain dose or length of time. It showed up consistently across different groups, and the effect held up even when the data were tested multiple times, multiple different ways, making the findings more reliable. The supplement he had started without even thinking about inflammation was magnesium in the glycinate form. Most studies use 200 to 400 milligrams of magnesium glycinate per day. Depending on the type of magnesium, that may vary. I only use 2 types of magnesium glycinate and magnesium threonate. Both are gentle, both help for multiple areas within the body, multiple types of metabolic supplementation. Magnesium glycinate, again, is a gentler form of magnesium. It's often used to support sleep, stress, and muscle recovery. Tom kept it in his routine because it was helping him sleep better. But now he had another reason to stick with it. Beyond sleep, didn't think about it, inflammation. His inflammation had come down. His overall risk profile was starting to improve. It looked a lot better. Supplement number 6. This supplement. In a large review of 23 clinical trials, this supplement was shown to reduce CRP by an average of 3.67 compared to the placebo. Again, those are huge numbers. It worked especially well in people who already had higher inflammation or people who had cardiovascular risk, just like Cliff. The studies were consistent across different types of patients and research designs, making the evidence strong and reliable. The supplement he had started for his joints was curcumin. Curcumin is the active ingredient in turmeric. You've probably heard of both. Again, most studies use 0.5 gram to 1 gram per day, 500 to 1,000 milligrams, often in a form that improves absorption, such as curcumin paired with black pepper extract, or liposomal formula. It's usually well tolerated and can support both joint comfort and systemic inflammation when taken consistently. Cliff noticed that his knees didn't bother him after long walks anymore. That was his goal, and what made it even better was the improvement in his lab work. His inflammation had come down, his heart health was still moving in the right direction. Supplement number 6. So we went to a supplement that works on the same inflammation markers, just through a different pathway. A 2023 meta-analysis reviewed several high-quality clinical trials, all the studies that are available on a certain topic. So it's one of the highest forms and best forms of scientific evidence. All the studies in this area found that this supplement significantly lowered CRP, IL-6, and TNF-alpha in people with elevated cardiovascular risk. The results were strongest in people with higher inflammation at baseline, and the benefits were dose-dependent, appearing most clearly after 12 weeks or longer. Alan added it to his routine. Nothing else changed. 3 months later, his CRP was lowered. His energy had improved. He said he was sleeping better. He felt like he was back in control. The supplement? CoQ10. Ubiquinol is another form of it. Most studies using 100 to 200 milligrams of CoQ10 per day, especially in people with inflammation or plaque buildup, that's what they use. It's well tolerated. It supports inflammation control, arterial health, and cellular energy. Here's what most people get wrong. They think CoQ10 is only useful if you're taking a statin, because it's been paired with statins, because statins can the CoQ10 part of our metabolism. So they think it's just to prevent muscle pain with statins. The truth is, you don't need to be on a statin or any medication to benefit from CoQ10. If you have arterial plaque, inflammation, cardiovascular risk, CoQ10 can help, all on its own. But one that includes movement, nutrition, sleep, stress management, and real consistency. People use them wisely. Please use them wisely and use them to support the progress that you're already making in lifestyle, not to replace lifestyle. Visceral fat, that's a big deal. It's one of the major hidden culprits in cardiovascular inflammation. If you'd like to see how to get rid of that visceral fat, take a look at this video right here.